Today's video is a little different. I'm answering your questions. You've left so many thoughtful comments and asked such great questions that I wanted to dedicate an entire video to responding to them. I love seeing this engagement, so please keep the questions coming. They help me create content that truly serves you or the families that you work with. Hi, my name is Dr. Dana Johnson. I'm an occupational therapist with a PhD in child mental health and development, and I have advanced training in functional and nutritional medicine. I've worked with families for over 20 years, helping them better understand their child and the best ways to support them. So what did everyone want to know? Well, most questions centered on motor loops, which actually doesn't surprise me at all. These concepts can be tricky because each individual is so different and each motor loop is so different. I also received questions about whole body apraxia, and after going through it all, I'm going to talk to you about the one thing that has to change for parents and professionals to figure out how to support individuals with whole body apraxia. So let's get started. So first question, can you have whole body apraxia and not autism? The simple answer is yes. My clients who I see who are complex autism, some are non-speaking, some are unreliably speaking, and most, if not all, have some apraxia. Now, if they're unreliably speaking, they tend to be less apraxic, meaning, they have better motor skills, and that makes sense because they do have speech. It's just not reliable. Where my non-speakers are more apraxic, and we tend to see, not always, more impulsive movements or behavior. Now, I've also seen clients who aren't on the spectrum. They're not autistic, and they have whole body apraxia. So just because you have autism, a lot of times it does imply that you have motor planning issues, but it's a spectrum just like autism. So you may have more skills than others, but you don't always have autism if you have whole body apraxia. Okay, so second question. Does jumping on a trampoline help with whole body apraxia? Now, I get this question or variations of this question quite a bit. So things like jumping on a trampoline or bouncing on a yoga ball, those aren't intentional. So when we think about supporting whole body apraxia or building the intentional motor movements to support those with whole body apraxia, we want to think about exercises and activities that require the planning, that require the initiation. Because if you think about jumping on a trampoline or bouncing on a yoga ball, they're not initiating that, right? That's the rebound from the trampoline or the yoga ball. So, it provides great sensory input. So those who need that sensory input, that's great for them and their bodies. But when we're talking about actually working through the sequence of motor planning, that needs to be done with something that requires that planning, and most often is going to require more support. Your child can probably jump on a trampoline without you motor coaching them, right? Now, climbing onto the trampoline, that's a different story. Maybe they struggle with that. So just thinking about what activities can I help my child to better work on motor planning, think about it like it's the intentional piece. We have to have some thought involved. We have to have some sequencing involved. We have to be able to initiate. So different activities, but definitely both can be beneficial. Okay, next question. Is there a difference between self-injurious behavior and aggressive behavior towards other people? So meaning, are they caused by the same thing? And are these behaviors, in quotes, a sign of whole body apraxia? So let's kind of break this down a little bit. First of all, aggressive behavior. I want to kind of define that a little bit. So aggression in and of itself implies intent. There's an intent to hurt somebody, let's say, right? So there's planning, there's sequencing of that aggression. Now, individuals with whole body apraxia, that's their struggle. They struggle with planning and sequencing movement. So it may look like it's aggressive, or I have some call it violent, which, to the average person, of course, that's what it's going to look like. but we have to think about what that means. And so aggression, violent behavior, I don't feel that any of the clients that I work with are intentionally trying to hurt somebody. So I'm just careful because aggression and violence, that's negative. And if you have whole body apraxia, you can't control your body. And now someone is saying that you're doing it intentionally, right? And I know that not everybody understands whole body apraxia, but it's important to kind of think about what words we're using, especially around the individual. So that's aggressive behavior. Now, self-injurious behavior is when the individual themselves it looks like they're hurting themselves. So that could be like biting their hand, that could be hitting their head. It's really hard to watch and to see, but that's self-injurious behavior. And for both self-injurious behavior and aggression or, injurious towards others, that is under the umbrella of impulsive movement. And impulsive movement, we don't have control of. It typically happens in the non-thinking area of the brain, or it does happen in the non-thinking area of the brain. So there isn't any thought going into it. It's a reaction. So typically when we're in fight or flight, we're going to act impulsively, but that's because we sense fear, right? So that's what's happening with aggressive or injurious towards others behavior, and same thing with self-injurious behavior. So they are caused by one of two things typically. Number one is emotion, so strong emotions. The second thing is sensory overload. So we know that individuals with autism struggle with sensory processing. So when they reach a threshold where their brain just can't process it anymore, that's when we tend to see this impulsive behavior. Now, how does it get to be self-injurious? Well, early on in that whole sequence, it may be that they bit their hand because the sensory input, whatever that may be, was just too much for them to bear. So they started doing this, biting their hand, and then just like anything else that we practice over and over again, it's permanent. Now it's the automatic. So now we're doing it every single time that our brain goes into that fight or flight, or we get anxious, right? Because remember, it's triggered by an emotion or a sensory experience, so overload. So that then is practiced over and over again. It's really hard to undo because at that point, it's what we call myelinated or permanent. We do it automatically. Essentially, are these behaviors a sign of whole body apraxia? Potentially, and I would just say more than likely yes. And here's why. Because I don't believe that they want to do this. So if they don't want to do it, then they're not going to do it. They would be able to stop themselves. Now, I also said that it's impulsive, meaning that they're not thinking about it. So it's a reaction to a sensory experience or a strong emotion. And we've already established that it's now permanent because we've done it over and over again. And so this is what is going to happen each time. Now, I did talk about this in my last video that I just uploaded last week. Specifically talked about self-injury and then possible reasons for that. Now, one thing that I do want to also highlight with this is that self-injury, or when you had talked about aggression in your question, sometimes that can be a result of a medical issue or pain, right? And if your child is non-speaking or unreliably speaking, you can't ask them if they're in pain and you can't have them explain what's going on. So just keep in mind that what you're seeing on the outside, meaning I'm hurting myself, isn't always a sign of frustration or anger. It could be a sign of I'm in pain. And so that's something to think about. Now, aggression or injurious towards others, that also isn't something that I believe is intentional. It's literally my body's overwhelmed, and that's what it's going to do completely uncontrolled. Okay, so then what is that one thing that I said that parents and professionals need to change in order to support individuals with whole body apraxia? Well, it's your mindset. Sounds really simple, right? But for most of us, it's not that easy, especially if you've heard that same message about your child or, one of the kids that you work with over and over again. Now, professionals typically are trained by the experts, and so often we use these strategies that we've been taught, but they tend not to work as successfully. And we can't just flip our mindset like a light switch. And if you're like me, I need to have evidence. I need to understand the why before or I can shift my thinking. And that might be you too. And that's actually why I created this channel, is to help with that mindset shift. Because for years, I was taught that individuals with complex autism and whole body apraxia had significant intellectual disabilities and, in some cases, significant behavioral issues, meaning that they were doing things intentionally and I had to extinguish, so to speak, those behaviors. Somehow we equated this non-speaking or nonverbal with lack of intelligence. When you actually stop and think about this, it doesn't make sense at all. So changing your mindset is the key to supporting your child and the individuals that you work with. But like I said, shifting it is both the easiest thing and the hardest thing to do. When you reframe your thinking to this is a motor planning issue, this is a neuromotor issue, and they don't always, just think about this, they don't always have control of their body. That's a huge mindset change. And especially when we have concocted these beliefs, which, by the way, are not facts. Beliefs you can change. If it was a fact, you can't. So I challenge you to kind of come up with those beliefs that you have and think about how are they related to what I'm talking about with respect to whole body apraxia. Now, once we realize these things, like they don't always have control of their body, we can understand two critical things. The first, what their body does may look like intentional misbehavior, but it may actually be whole body apraxia. And I get this question a lot. How do we know which is which? And I'll say, we don't know. But there's one thing that I do know, and that is that when we can support them through coaching their body, it doesn't matter because breaking down the task and supporting their motor planning is going to give them the best chance at success. And the second critical thing is that they may actually be able to learn, meaning that you can presume competence, that they can learn, they can understand, and they have the cognitive abilities that we didn't think possible. It's just that they can't demonstrate it because of the motor planning issue. And remember, presuming competence is not the same as presuming knowledge. I don't presume knowledge in anyone, but I do presume competence in that all of us have the ability to learn and that we want to learn. So that in and of itself is a mindset shift. Now, whole body apraxia, motor loops, or is it behavior? All of these things are not black and white. The strategies that we talk about aren't miracle solutions that happen instantly. These take time and consistent practice, but you're here now. And sometimes you may have to work on regulating yourself first, but that's okay. You can do this. If you found this video helpful, please give it a thumbs up and subscribe so that you don't miss any future content. And drop your questions in the comments below because, like I said, I love hearing from you and your questions because these questions are going to shape future videos and I love doing Q&As. Thanks for watching and I'll see you on the next one.